And good morning from the United Kingdom and good evening from Australia. Thank you for joining myself, Matt Daly, and the Nightingale Challenge team for the second webinar in a series building up to the launch of the Nursing Now 2020 campaign. The Nightingale Challenge is part of the Nursing Now global campaign to raise the status and profile of nurses and midwives, but they are often undervalued and unable to work to the top of their licence, an extraordinary waste of talent and resources. 200 years have passed since Florence Nightingale's birth, a nurse, innovator, reformer and leader of improving healthcare, who inspired those around her and future generations. And recently 2020 has been declared as the year of the nurse and midwife by the World Health Organization, and given our profession the once in a generation opportunity to invest in our young nurses and midwives and prepare them for the future. The Nursing Now campaign and the part the Nightingale Challenge plays in this is our opportunity to continue the legacy handed on to us by improving global health, by raising the profile and status of nursing and midwifery worldwide, in collaboration with the World Health Organization and the International Council of Nurses. It seeks to empower us as nurses and midwives, regardless of our location in the world, to take our place in the fight against 21st century health challenges by encouraging greater investment in our workforce, recruiting more of us to senior leadership positions in healthcare, our sharing of good practice, conducting research into the areas of greatest impact, and allowing us to have a more prominent voice in healthcare policy making. The vision of this campaign is to improve health globally by improving policymakers and supporting participants directly to lead, learn, and build an international movement, achieve influence, and to acquire inspirational leadership for change. And by participating, we're asking you, the employers, to provide a leadership and development program of your own devising dedicated to the Nightingale Challenge. Some of you may find it helpful to draw on existing courses and programs when designing your training and development packages, and there are available resources on the Nightingale Challenge website that will continue to develop and grow, and these webinars will contribute to this. Programs as a suggestion should include the opportunity for personal development, including leadership, service improvement, management, knowledge of the wider organisation, but we ask not purely clinical. Other suggestions could be shadowing opportunities for senior trust figures, coaching and mentoring by senior figures and by other professions and organisations. And you can include what you're already providing, but as part of the Nightingale Challenge commitment. And this is an opportunity to make this in your own image, but for the benefit of future leaders as part of this global movement. Support is offered from us in the form of a global platform that will promote the activities and developments through a webpage and social media, coordination to enable shared learning opportunities and the contact to do so, offer guidance on programs, research evidence of good practice, and global content to supplement the local programs. All of this information can be found online on the dedicated Nightingale Challenge webpage, with much more information that can be detailed here. So please let me now introduce our host for this webinar, Margaret Martin, Nurse Manager for the Development of Practice and Workplace Capabilities at South Eastern Sydney Local Health Districts in Sydney, Australia. With over 40 years working in health as a nurse and a midwife, with much of this time spent in clinical and classroom teaching roles, she has held a variety of leadership and management roles, where for the past decade she's been involved in the preparation and support of health leaders, especially nurses and midwives. Currently managing a small team of innovative nurses and midwives who are focused on leadership, culture, and excellence in care. She holds a master's degree in adult education and has a wide experience in the design, implementation, and evaluation of curricula. The title of our webinar today is Leadership at the Heart of Care, where we explore styles of leadership, leadership in management, and the domains of compassionate leadership. We will have time for questions and answers at the end of this presentation, and I hand you over to Margaret now.
Thank you. Thanks, Matt. So what is leadership? It really is the ability to attract followers, to actually takes a group of people in a direction that is usually mutually agreed. So there are different types of leadership. Generally, we would say there are two main groups, or two main types. There are transactional leaders and transformational leaders. Transactional leading is more a traditional way of leadership. Generally, it's associated with command and control, telling other people what to do and how often to do it, really, and then to define the parameters of the performance. Transformational is a much more modern concept. It actually has a number of other names, but the two groups, I'll just leave it this for the time being. Transformational leaders have the ability to work with others and have others work with them towards a shared goal. They're much more able to negotiate and collaborate with people, and they tend to use shared values to get people on board, to engage them. It is a really interesting thing, though, that in nursing and midwifery, we've come from a tradition of command and control, and that's often very challenging for people if you start asking them how to do it together, if you try being collaborative with your peers. So how is leadership different from management? Well, the fundamental difference is that management is about process and processes. There's a lot of doing in management. It's quite often a task-heavy process, and any managers listening will know that doing the payroll, doing the stores, all of that stuff is very process-heavy. And managers usually have a degree of positional power or authority, so there tends to be a hierarchy in management. Leadership is really different. Leadership is about people, and the job of a leader is to actually get people on board. So leaders can come from all levels of an organisation and a hierarchy. Leadership is really interesting because it engenders followership. You can tell people what to do, and they might or they might not do it. If you lead people to do it, they generally will follow. However, it's really important to note that leaders can be managers and managers can be leaders. The two things are certainly not mutually exclusive. In the terms of the types of leadership, transactional leadership is directive. It has a very heavy reliance on extrinsic motivation and reward, and it actually aims to maintain the status quo. So change is not the big agenda. It's useful in some situations. In an emergency, for example, where you have to say, can you do this? Will you do that? Now do that. But in every day, it is much easier to have transformational processes in place. It means that you can negotiate tasks and be flexible. It means that you can use intrinsic motivation, that is the motivation of the person being led. You get buy-in that way. And most importantly, it is oriented towards change. The one thing we know in health is that change is a constant. You only have to think about the degree of technological change that has occurred in the last 5 years, let alone the last 100 years. Change is the one thing we know we have to engage in, and we get very tired of it. So a leader really needs to have people on board in a way that allows them not to duck the next wave of change, which is natural human behaviour, but to actually say, what is the advantage of this? How will we benefit? And in the case of us as nurses and midwives, how will our patient care improve and our outcomes for that individual human improve? So I'm going to present to you a schema for leadership in health. This is a way of actually just looking at the parts that we need to focus on as leaders. These are developed from work that has been done here in Australia, looking at what it is that connects people in health. It's been quite a big project in my health district. The 4 elements are connecting human to human, engaging as a team, creating effective workplace cultures, and self-care and well-being. Let's talk about connecting human to human. Human to human doesn't just mean human, the nurse to the patient, the midwife to the woman. It doesn't just mean the organisation, connectiveness manager to staff member and so on. It is actually about really connecting and respecting each other as human beings, regardless of where we sit. And that might seem self-evident, but where people are connected as humans and have a form of relationship, they are actually much more likely to engage with other people. So connecting has a number of elements: communication, listening, being heard, not being judgmental, feedback, giving and receiving. It is individualised approaches to care, it's individualised approaches to individuals, empathy, compassion, kindness, or caring really, and making a difference. These are the things that really we have identified as being essential to connecting. Engaging as a team is the next element. Teamwork, supporting each other, working together, feeling as if you are all on the same page towards the same goals. Collaborating respectfully, building relationships and partnerships, and that's between the nurse, the other members of the multidisciplinary team, the patient, of course, the patient's family, relatives and carers. And trust is really important in this, as you will know. Role clarity is essential. The issue of role clarity cannot be underestimated. People think they know what their roles are, but unless there is actually explicit role clarity, there's room for error. Honesty, authenticity, strengths-based approaches, these are all part of engaging as a team. The next element is creating effective workplace cultures. This involves voice, and voice is a really important aspect of the whole issue of nursing and midwifery. Being able to use your voice to actually ensure that care is provided in the most appropriate, most evidence-based way does provide the best possible opportunity for the patient, client, woman to actually have a good outcome. For this to occur, we need to understand our own way of being in the world, but also we need to understand that there are different methods and different languages associated with communication. And I don't just mean language associated with your community or ethnic group. I mean language associated with how you communicate with another health professional or with a patient. It is really important in this space to make sure that in terms of workplace culture, we base everything on a shared set of values. A lot of organisations do have a set of values that you can refer to, but even at a more fundamental level, a team needs to know what they value. And that usually takes a little bit of work, but it certainly does open up the opportunity for developing an understanding of each other, which does make a big difference to effective workplace culture. And the fourth and probably least recognised element is self-care and well-being. And by well-being, we refer to the physical, social, emotional, psychological safety of all of our staff and of our patients. So it is really fundamental that to care for others, you need to have enough in reserve. If you're burnt out, you can't do it. Paying attention to your own needs is a very important aspect of being an effective healthcare professional. We look at resilience as being part of that, being individually resilient, but also team resilience is really important. Teams can get exhausted by the pressure of workload, and there have been many instances all over the world where poor care has been through poor teamwork. And poor teamwork can be associated with lack of well-being in the team resilience. So resilience is built by good health, but it's also built by understanding and through reflection. So clinical supervision, coaching, as Matt said earlier, these are all really important aspects that shouldn't be ignored in any way. Emotional intelligence is a very important aspect of this, understanding yourself, understanding others, really taking a little bit of extra time to think of what it's like to be in someone else's shoes and what on earth you're doing in your shoes today. Some days we just don't have the resilience that we need. We need to learn constantly. We need to be developing constantly, of course, and we need to be mindful of what we're doing in the world. So mindfulness through meditation, through deep reflection, all of these things can be very, very helpful. So what I've tried to do is just give you a very brief overview of some of the elements that make effective leaders. And I guess the opportunity now presents itself to ask some questions.
Okay, does anyone have any questions at all? I do have some. I have got some. I do have some questions, so that's okay. So, talking about leadership skill, what skills if I was coming as a junior nurse, what skills do I need as a leader?
I think one of the things that's hardest is for junior nurses, for example, to develop the confidence to actually feel that they can be a leader. Leadership is really the thing that you do to be heard on the part of the patient. It's more than advocacy, but advocacy is part of it. So knowing your voice, knowing that you practice to the highest possible level, that you're evidence-based in your practice, they're the things that start your leadership journey. And actually taking time to understand how the organisation works and how you work in the organisation. And that organisation might be a small team, it might be a very large team of hundreds.
Okay, thank you. So really, we're talking about bedside nurses. So what is the role? What is the role of the bedside nurse or midwife's role in actually leading care?
Fundamentally, it's communication. The nurse is that person or the midwife who sits between the patient or the woman, in the case of the midwife, and the rest of the healthcare team. Nurses are the people who are there 24 hours a day, 7 days a week for that person. So being able to actually recognise that the nurse sees and hears more often very much more physically intimate and socially intimate interactions with the person that's being cared for than any other healthcare member, allows you to develop the confidence to be a voice for the patient and their family when you need to. And the most important skill probably is listening.
Yeah.
Okay. So, sorry to butt in there. So we have some questions that have been typed in now if we want to start asking those. Okay, so the first one is from Tracy Miller, and that is, can a junior nurse have a leadership role?
Definitely. So a junior nurse isn't necessary, a leadership role is not necessarily being in charge of a shift or being the nurse manager or the staff nurse, whatever. The leadership role is actually contributing to care through handover effectively, through meetings, ward and staff meetings, being a really positive role model to others about professional standards. That's leadership. And actually speaking up when there's something that needs to be said is probably the first steps that relatively junior nurses take. And I would include student nurses in that. Fresh eyes often provide a really good opportunity to challenge what has been a practice for many, many years or weeks.
Okay, and we have one from Paula Spooner, which says, do you have any tips for engaging staff with leadership development and also getting their managers to release them? We have manager feedback that the nurses will leave if given too much leadership development. Very frustrating.
Very frustrating, but nurses will leave anyway if they're frustrated and not happy. So one of the things that you need to do as a manager is actually recognise that professional development is a responsibility for you to provide access to. If you don't, that person will become probably disgruntled eventually, and they'll go somewhere else where that opportunity exists. And the way I've looked at it for the last probably 20 years is if people stay in the system improves. We will all work in very big systems. We don't want to lose nurses from nursing. It's inevitable because of a whole lot of reasons. Generational change is just one of them, that nurses will change positions and posts. Very few nurses in large cities particularly ever get the chance to stay in the one spot forever because they're really happy to move on. Small centres often have that issue, but developing those staff is even more important. And getting them off, structure your roster. And remember that leadership can be taught by example and in small steps. It isn't necessary to release people for long periods of time. It is necessary for people actually to have space to learn though.
All right. We have one from Nazia Ilyas who asks, can transactional leadership and transformational leadership go together?
Yes, they have to really in nursing and in healthcare, because you can't come to work and not allocate the care for that day. However, you can negotiate how that care is allocated. So transactional and transformational, often people think transactional is bad. It's not bad. There is a place for transactional leadership, but working in transformational ways, being inclusive, asking people, what their particular needs are in terms of learning for the day or what goals they'd like to achieve. They're the things that make a big difference overall to transforming the workplace.
All right, and we have another question from Paula Spooner who said, can you mention that emotional intelligence and knowing oneself is vital. Do you recommend Myers-Briggs or similar before the leadership development starts?
I'm a big fan of Myers-Briggs, but it's expensive and not all that accessible to everybody. So there are any number of inexpensive or even free assessments or quizzes or whatever. The Gallup Strengths is one. The VIA Strengths, I think, is free pretty much. But what they do, all of them, and I'm leaving Myers-Briggs aside because it's much more detailed, but what all of them do is raise awareness of who you are and who other people might be. And it opens up the opportunity then for a conversation. Because we do like people to sit in boxes, but that actually isn't how human behaviour works, is that none of us sit in the box for the duration, really.
Alrighty. We have another one from Tracy Miller who asks if you can repeat the elements of leadership.
Yeah, so the four elements of the framework or the construct that we use are connecting human to human, engaging as a team, creating effective workplace cultures, and self-care and well-being.
Great. And another from Nazia Elias who asks, please share your thoughts about self-care.
It's interesting, actually, because the more I know about self-care, the more important it is. So self-care is very individual. Some people might go for a run, a walk, a swim, physically exercise. Other people might meditate. But whatever it is, there has to be an element of this is for me, and not just in an indulgent way, but in an elucidating way. So self-care requires reflection. I was a swimmer for many, many years, and swimming up and down on the black line, for some reason, was almost meditative. Now I actually meditate because it's easier for me, but what is important is the time out, but the thinking that goes in a refreshed way after that time out. And so a lot of people respond really well to clinical supervision, either individually or in groups. And I mean reflective clinical supervision, not just the form of clinical supervision where you review care. That's important, obviously, but why the care was given that way. What was I thinking when I was giving that care? That's the kind of thing that really helps us develop as a professional, but also builds our resilience.
Great. So we have one from Louisa Hill who asked, how can we support each other's well-being on a daily basis?
So, such a good question, and because we tend to get to work and hit the ground running. We've been working on this at several sites in Sydney. We've got people who actually do a 10-minute mindfulness. One of the resources that is in that presentation, which I'm not sure you saw, is the a Nursewell app that is free to download, and it's got meditative responses in it. It's also got lots of things like basic Pilates that is great. Some teams like to do that at the beginning of the session as stretching and a bit of back care. All of these things can just be done in 10 minutes as an example of how you can actually get on board as a group. And we're finding that teams that do it really appreciate it. So, for example, when my team of 10 started doing it, it's a 10-minute once a week, the other people on the floor, other teams started coming to us to join in. And now that group can be 25 and we need to do 2. So people actually really appreciate it once it's offered. And it doesn't take long.
Great, thanks, Margaret. There don't seem to be any more questions. I don't know, Matt, if you had any more you wanted to ask?
There's one question that comes up quite often from my practice, and I hear it very often, and that's, how do I challenge other people's practice?
Oh, such a good question, really, isn't it? And all of us struggled with that. Often it is easier to ask a question in a way that is less confrontational if you think it out first. So, for example, instead of saying, why did you do it that way? You might say, I noticed that you did it in a certain way. That's different to the way I do it. Would you mind talking me through it? And people then go, oh, actually, I'm not sure why I do it that way. And you can move into the next part of the conversation, which is, yeah, well, what worried me was maybe you could contaminate the field doing it that way, or you could do this, you know, that kind of thing. Sometimes practice is much easier to challenge than behaviour. And so people who, my personal favourite, roll their eyes in a meeting and go, oh, like that, or turn away. Those people I always challenge by saying something a bit sarcastic probably, but something that brings attention to the fact that I've noticed them doing it. I might say, oh, Sally, are you ready to leave? Or something like that, that brings attention to it. But behaviour is much more difficult to call because you have to have a lot more confidence to do that than to question basic elements of how something was done. And if it's as simple as hand washing, you just say, I didn't see you wash your hands.
Got you. Lovely. Thank you.
Mm.
I think one more question I have, and that's thinking as a manager, as a senior, how would I get, or how do I get staff to step up to show leadership and develop leadership?
I think one of the best ways to do it is to admit that you're vulnerable, that you're fallible. People often will put a senior person, particularly if they've got positional power, on a bit of a pedestal. And that means that they won't challenge them, or there's a bit of fear associated with that, which is really not that helpful. So that would be one of the times when you could actually, as that person, say, I don't know the answer to that, or this is really challenging for me, or have you got some ideas that might help me with this? Because that vulnerability then invites the opportunity of people to actually contribute their ideas. And the basic, what they call coaching on the run, where somebody asks a senior manager a question and wants the answer, it's so simple to get into the habit of saying, so what have you done and what do you think needs to happen next, instead of directing. And that is a very good way to role model the openness that is essential for good leadership.
Lovely, thank you. Are there any other questions from anyone? No, I don't think there is. Okay. What I'd like to do is thank you so much for your time today. Very much appreciated. And to everyone that's attended today. And I just want to make some closing remarks. Today, there are 12,045 nurses and midwives from 289 employers in 41 countries that have joined the challenge. We encourage others to do so, as well as sharing details of the Nightingale Challenge across your network. Encourage others to accept the Nightingale Challenge. That takes just a few minutes online to join, and to spread the word by sharing, posting and reposting support for the Nightingale Challenge on social media platforms and at any events or conferences that you go to using the Twitter hashtag Nightingale Challenge. Healthcare is changing rapidly, and so should the workforce. Nurses and midwives are the largest group in this workforce. Let us prepare them for the future. Let us seize the opportunity that 2020 gives us to shape a different future for our profession by investing in the next generation. Thank you for your questions and spending time with us today. Please look out for details of the forthcoming webinars in November and December that will be distributed to you in the near future. Thank you for today.